The Medicaid program was established by federal government to provide medical coverage to poor people. It is going to provide medical benefits to people who have low income, and low income is determined by the federal poverty level guidelines. Federal poverty level guidelines can be found on cms.gov. They are published, and it is a ratio of family income versus the number of people within that family unit. So Medicaid is primary for people who have low income, people who have no health insurance, or people who have inadequate insurance. There are several differences in the way the program is funded, in the way the program is administered, who is eligible, and also there are differences in reporting, and I'll touch on each of those just real briefly. You heard earlier today that Medicare is federally funded, whereas Medicaid is jointly funded between the federal government and individual states. In order to receive federal funds for a Medicaid program, each state has to submit a plan to CMS, which will then be approved, and then they'll have to adhere to certain federal guidelines. Right now, Mississippi matches 3-to-1, 3 federal dollars to every 1 state dollar. Although Medicaid is created by federal statute and subject to federal guidelines, the states are largely responsible for administering the program. This responsibility includes determining the types of programs that are going to be available under the Medicaid umbrella in a certain state, who is going to be eligible to receive those benefits, and then also compromise of the liens. When you're settling with Medicaid, you're going to be dealing with the division of Medicaid as opposed to these various entities that you've heard about today.